All right, maybe you've seen recently some television commercials telling baby boomers to have the test for hepatitis C, but why is that necessary? Dr. Mark Viegas joins us today from CHI St. Vincent Primary Care at Little Rock Midtown to talk a little bit more about maybe what you've heard about this hepatitis C. Good to see you.
Nice to be here.
Yeah, let's talk about why are baby boomers specifically targeted for this test?
Well, although anyone can have hepatitis C, over 75% of those who test positive for hepatitis C happen to be baby boomers who are born in the years 1945 to 1965.
Okay.
In fact, baby boomers are 5 times more likely to have hepatitis C than the rest of the population.
Okay, and I'm just doing the math because I'm 65, so it's about 50 to 70 years old? In that range right there?
About.
Okay,
yeah.
good deal. Why are they more susceptible then to hepatitis C?
Well, we do not fully understand why baby boomers are susceptible to this, but we suspect that they became infected around the 1970s to 1980s, where rates of hepatitis C were fairly high.
Okay.
And it is possible to live for decades with hepatitis C and not know it.
Really?
And be completely asymptomatic. So a lot of these baby boomers are living with hep C unknowingly.
And do not know it. Okay, let's talk about some of the ways you can get hepatitis C.
Sure. Now, hepatitis C is contracted when you come in contact with the blood of an infected person.
Okay.
So many of these baby boomers contracted hepatitis C through the use of, because they received blood products in the hospital, either blood or blood products prior to 1992. Now in 1992 there were universal precautions and guidelines where blood would be mandatory, there'd be mandatory testing of blood for hepatitis C, but prior to 1992 that was not in place.
Okay, interesting. So what should we know about the disease then?
Well, baby boomers need to know that you can live for decades with hepatitis C without any symptoms, so that's why it's very important to get tested. Now, over time, hepatitis C can cause widespread liver failure by slowly killing off your liver cells. And it could also cause cirrhosis, very similar to alcoholics. It could also cause liver cancer and then eventually death. In fact, hepatitis C is the leading cause of liver transplants and liver cancer.
Okay.
But it's important to get tested because there is a treatment for it, and in many cases we can cure it with the treatment.
So you can live without knowing you have it. Are there any symptoms that we can tell people to look for?
Well, with chronic hepatitis C, unfortunately there are no symptoms until it's too late, until you get the liver damage, the cirrhosis, or even the liver cancer. So it's very important to get tested, and it's a simple blood test we do, which tests for the antibody that our immune system creates in response to the hepatitis C virus. And if you come back positive for this antibody, then we can do something called a confirmatory test, which actually tests for the genome of the hepatitis C virus itself.
So is this something you need to talk to your primary care physician about?
Oh, definitely. And then we could do the simple blood test.
Okay, very good. Wow, I had no idea, and I think a lot of us did not know that you can live for years with it and not know it. So that's good information to have. Let's put up, of course, on the screen what you need to know, of course, about CHI St. Vincent. And if you have any questions about this test or any other medical issues, you can do that right there at CHI St. Vincent Primary Care. And Dr. Viegas is there at the Little Rock Midtown location. So now you know a little bit more when you hear about hepatitis C.